Hi there, and welcome to this closing session of the WHO Western Pacific Region Partners Forum. We're very sorry about the technical difficulties that we had earlier with the live feed, but we're bringing this session to you nonetheless. Thank you so much for being here, and thank you even more importantly for your participation, enthusiasm, engagement over the last few days. Now that we are at the end of the forum, I think I can be a little bit honest and say that when we first came up with this idea of doing a meeting completely online, we didn't quite know how it was going to work, but we have been absolutely blown away. More than 950 partners registered to participate in the event, from 50 countries all over the world, not just inside the Western Pacific region. Of course, we've had hundreds of WHO staff participating as well, here in our regional office in Manila and in our 15 country offices across the Western Pacific. It's been especially nice to see photographs of some of the face-to-face meetings that have been happening in Papua New Guinea and the Solomon Islands and other places. Here in the main group of the forum, the main discussion group, there have been almost 4,000 posts, comments, reactions, really terrific engagement between WHO and our partners. But even nicer to see has been some of the engagement between partners themselves. It's also, we're very proud to say that it's also been an environmentally friendly meeting. If we had tried to bring all of you together here in Manila or someplace else, our back of the envelope calculations say that we would have emitted something like 600 metric tonnes of carbon dioxide into the atmosphere. But we didn't do that, and we've managed to have a really terrific few days instead. Now, it would be impossible to try and sum up the richness of the discussions that have taken place over the last few days in just 20 or 30 minutes. So the good news is that we're not going to try to do that. Instead, we're going to give you just a little snapshot of some of the different discussions and different discussion topics. So to help me do that, we've got a great panel of colleagues here at the regional office. Let me introduce them to you quickly now. Of course, the Regional Director, Dr. Kasai, is back, and we'll hear from him a little bit later in this session. Now let me start from the other end of the panel, Dr. Yungguo Liu, who is the Director of Program Management here at Wipro. Daryl Barrett, who's been moderating some of the discussions on the very important topics of non-communicable diseases and ageing. Dr. Lee Ailan, our backcasting expert. Liv Law-Davies, who's the Regional Communications Manager here at Wipro. And of course, Anna Wadwani, who was the moderator of our terrific town hall, youth town hall segment from yesterday. So let me go to the panel now to hear from them. Dr. Liu, I'm going to start with you, if that's okay. I've seen you dipping in and out of some of the different discussion streams over the last few days. Tell us a little bit from where you sit about your impressions of the forum. How does partnership look in the Western Pacific region to you?
Thank you very much, Angela. I should say that the last 3 days has been very exciting, very impressive, and a very new experience to me. I really like this type of partnership and discussing very openly. I really appreciate this opportunity. Partners brought in a lot of new technology, new capacities and ideas about how we use the old wisdom to address the new challenges in our region. It's really inspiring to me. I think that we should continue and strengthen our partnership work together to achieve universal health coverage and leave no one behind. And I want to stress 2 parts that specifically impressed me. One is about innovation. I really appreciate the partners contributed and raised lots of innovative ideas. That technology nowadays develops so fast, and the world we are living also changing very fast. I think these new ideas will enrich the innovation consideration and help us to think about how we adapt new technologies, new ideas to address the traditional health issues and address the new health challenges ahead. The second part I want to stress is that I really like the youth section. That impressed me very deeply, that definitely youth represent the future of our region, of our world, and their sharp questions really impressed me. And their thinking, their ideas, their concerns is our concerns for the future of the health. So when we try to build the safest region and the healthiest region under the leadership of our new regional director. So I hope this type of discussion can continue. Definitely we can use the new IT platform to continue our discussion. And more importantly, for me, because I'm working on the program management, I'm thinking that how to incorporate these new ideas into our work plan for the future and really implement and put these new ideas into action and become, make things happen. Thank you.
Great, thank you so much, Yungo. Next, Daryl, I want to come to you. You had the very difficult task of trying to moderate a enormously robust and detailed discussion about NCDs and ageing. Huge topics for countries in our region, huge concerns for partners in our region. What were the 2 or 3 top messages that came out of that discussion?
Well, thanks, Angela. I guess I want to reiterate it was massive. I brought a cheat sheet because there's no way I can do justice to all the comments. I mean, I think one of the important things was that it gave all of us an opportunity to meet new partners. That I certainly were introduced to many different partners that otherwise I would not have knew even existed really, and doing work either focused on NCDs or on ageing, or obviously there's a crossover, so a focus there. And I think overwhelmingly there was a consensus for the support of the issues that came up in the white paper around NCDs and ageing. Particularly, I think that people appreciated the focus on universal health coverage and an approach to addressing primary health care. I think that recognises the fact that we need to be looking at how we can deliver the health services that people need where they need it. And obviously this is often close to home. I think a couple of issues that came out that probably needed a bit more emphasis. One was around mental health. There was recognition that this was a really good topic to have in the white paper, obviously. But what seemed to gravitate with a lot of discussions was the need for us to look at dementia and have a bit more of a focus on dementia. Also, what came up in the discussions were issues around palliative care. And so palliative care isn't addressed in the white paper as of now. And I think a lot of partners were saying that this is an important issue that needs to be addressed. So those two things sort of stuck out to my mind in terms of some of the issues. And then building on from what DPM had mentioned about innovation, I think towards the latter end of the discussion, we were seeing people discussing things around telehealth and telemedicine and how we can bridge the gaps around access to healthcare services, particularly if we're supporting people close to home and particularly if we're looking at ageing populations where people have difficulty travelling and accessing healthcare. I didn't even look at the sheet because I know that there are so many things. So for the partners that may have put in great comments and great references and great materials and shared practices, we will be digesting all of that. So even if you didn't get a flag raised today, don't worry, those comments are definitely not going to go unheard.
Great, thank you very much. You rose well to the challenge, the impossible challenge that we gave you of trying to sum up that incredibly rich discussion in just a few minutes. Ailan, you are a convert yourself to the idea of backcasting. It's a term that is a little bit unfamiliar to some health stakeholders, but I saw in the discussions that there was a lot of curiosity and interest in this idea. Tell us, how was the discussion about backcasting, and is this a tool that WHO and partners can use together for our work in the region?
Okay, thank you very much. First of all, I'm not backcasting expert, but I want to be the backcasting expert in the future. So the term of backcasting is pretty new to the people working health like me as public health specialist. But the backcasting approach itself is not entirely new to our partners. During this 24-hour discussion, I realized that many of our partners have already applied backcasting approach, but we didn't label as backcasting, and we might need to apply more systematic way. So the discussion with partners on backcasting has been very interesting, constructive, of course. There are some confusion on the term of backcasting. But most importantly, I realized that our partners like this idea. Let me quote one partner, how she said. She said, I personally like idea of backcasting because it captures a vision of where we are going and then allow us to have a wide range of pathway to that goal. So this is an amazing example. We have many other examples. Let me share two of them. One is we have one partner said backcasting, we dreaming put a man on the moon. That's backcasting. And also in the health field, we also have another example. We're working together with all the member states, donor partners, towards a safer and secure Western Pacific region through implementation or development and implementation of a common strategy we call Asian Pacific Strategy for Emerging Diseases. Thank you.
Great, thank you very much. And there were some really excellent examples, as you said, of backcasting in practice in the discussion groups, and we'll pull some of those out in the final summary report for this forum. Next, Liv, you led, again, a very robust and exchange and discussion about the use of strategic communications in health. Partners from all over our region, in fact, from all over the world. What are some of the challenges that we face in this area, especially when we think about partnerships? But then what were some of the really great examples that you heard about of how we can use strategic communications to improve health?
Absolutely. I was really struck by the strong consensus among all kinds of different partners that we had involved in the forum over the last few days. Some of whom are not necessarily, having communications as their core business, but were very much on board with the idea of strategic communications being really critical to delivering on health in all kinds of ways, no matter the domains that we work on. Some of the barriers and the themes that came up in the discussions included resource constraints, of course, also sometimes lack of capacity at country level to adapt messages and approaches to the local context, which a lot of partners highlighted as being really important. And also just generally kind of some of the challenges around getting people and institutions to evolve from perhaps an event or days or products focused to a more evidence-informed and strategic approach. But there was general recognition of the need to do that. As far as some of the examples that were raised of, partnerships, some really excellent examples that perhaps we can learn from and emulate in other areas. Some of the things that were raised were around being contextual, working with people on the ground. One of the things that the Vietnam Young Doctors Association talked about was a series of community days that they organise there once per month. There was another great example shared by the IFRC on using data to evaluate and adjust their communications approach to close the gender gap that they found in their social media activity. And another one that really highlighted the power of partnerships was on some joint advocacy and fundraising work that was done to mobilise billions of dollars to fund polio eradication. So overall, I would say the thing that really struck me was the interconnectedness of the different operational shifts in terms of backcasting, innovation, grounds up, communications. All of the discussion very much came together, and I think for me it just really spoke to how much we need to do all of these things kind of at once and together, and partners clearly recognise that.
Great, thank you very much. And one of the other connections, of course, was between communications and the Youth Town Hall. Yes. Anna did a terrific job, I hope you all saw it yesterday, of moderating a panel discussion with the Regional Director and young people, and then an online discussion for the 24 hours after that. Great job, Anna, pulling all of that together.
Thank you.
Tell us, what are some of the issues that came out of that young people are most concerned about in our region, and what does WHO need to do differently to engage with young people and partners who work on young people's issues?
Sure. So I think that one of the themes that kept coming through was interest in climate change and the environment, which makes complete sense because the Pacific is one of the areas in the world that's most affected by climate change, and what we do today will directly affect the youth of tomorrow. And something that I think older people who are working in this field don't always realize is that young people are already doing so much work in their communities to change behaviors, to advocate to decision makers about what they want to see. Now, one area that I think we could be doing a little bit better in terms of increasing awareness is NCDs, because a lot of people just aren't aware that the decisions that they make today in terms of their health, nutrition, exercise are going to affect them tomorrow. In terms of how youth should be engaged with WHO, I mean, I think that's really up to the youth groups. That's a question that we should be asking them. And so this youth town hall was such a great way to start off that conversation. I mean, you know, there's so many different ways to engage youth. Of course, they're constantly changing in ways that I don't even understand as a young person. There's, you know, constantly new apps that people are using. You know, if it's Snapchat, Instagram, Twitter, there's constantly new ways for us to communicate and reach out to young people. And so, I mean, that begs the question, how do we find that out? You know, it's to ask them, how should we be engaging with you? What's the best way to do that? What's the most effective way? So
Great.
that's what I learned.
Thank you very much, and that's definitely a conversation that we want to continue. To try to pull all of this together, I'm now going to ask each of our 4 moderators a couple of last questions. So in one sentence or less, tell me something that you learnt over the last 4 days about partnership that you didn't know before. So I'm going to start with you on this one, Daryl.
I guess for me, coming into this forum, I saw that our mechanisms for supporting people's health and well-being can sometimes be fragmented. But after this forum, I see that even if our mechanisms can be a bit fragmented, our convictions, our aspirations, and our potential next steps are much more solid, much more unified. So I'm a lot more hopeful that despite what's happening, it's actually a lot more unified.
Great. Thank you. Ailan, what did you learn?
One very impressive thing is I feel like the partners' impressive ability to connect backcasting with other operational shifts like system development, innovation, and grounds up. I so concentrate backcasting, but they connect others, so that's very impressive.
Great. Thank you. Liv, what did you learn?
Similar to what Ailan mentioned, I think before we came into this forum, we knew that partnership was important, but some of the examples that we've seen shared over the last couple of days have really, for me, kind of magnified the sense of the power of partnerships and how they're absolutely fundamental to achieving everything that we want to do over the next 5 years.
Great. Thank you. Anna, you told us a little bit earlier about what you learned, but if you had to sum that up in one sentence.
Sure. I think we all know that youth engagement is really important. But of course, one thing that came out of this forum for me is that it's sustained engagement that we really need to be focusing on. What are the most effective ways that we can be continuously engaging young people in health?
Great. Thank you. Now an even harder task, which is a question that you're only allowed to use one word to answer. How do you feel about partnership at the end of this forum? Anna, I'm going to start with you this time, if that's okay.
Sure. I'm feeling really hopeful. Yeah, I'm really feeling hopeful after all of those discussions and seeing all of the great examples shared of people doing great work in their communities and seeing all of the ideas that were brainstormed and people being able to talk to each other and really mesh and form new ideas. Sorry, that was more than one
That
word.
was more than one word, but that's they were all good words. Liv, one word, how do you feel?
Well, I'm going to push the envelope as well and ask for 2 and just say huge potential.
Ailan.
May I have 3 words?
Oh my gosh.
Connection and connection for the future we want to see.
Great. Daryl, one word.
Motivated.
Excellent choice of word.
That's 2. Really.
DPM, how do you feel?
I think
Great.
partnership is really powerful for health.
Great, great. Excellent words. So I now want to give the last word to the Regional Director, Dr. Kasai. It was his idea that we do this, that we bring people together over a few days, and it was his idea that we try to make this happen online in a way that would make it much more inclusive than I think a face-to-face meeting would have been. So, Dr. Kasai, how do you feel at the end of these 3 days?
Well, Angela.
And you can have more than one word.
Yes. Well, Angela, I am impressed, amazed, and encouraged in the past 3 days. And I wanted to thank Angela and your team and everybody who supported. And I also wanted to thank all the partners who engaged in the past 3 days. We discussed about the theme. We discussed about the operational shift. We had the youth theme. I was very happy to see those 4 themes that we heard from member states was also the theme that the partners are interested in. And partners emphasize that the 4 themes is actually even more important in the context of the SDG. And I was also happy to see there is a momentum generated that it is now time for us to work for the future. Operational shift part, at the beginning I was a bit worried, like a backcasting or guns up, how this can fly. But I was amazed about the depth of the discussions. And I think that is because these words resonate what people are also thinking. But I also noticed that we receive a lot of good advice. So I think let's put this into the white paper so that the forum outcome can be reflected. Youth. Our DPM, the Deputy Regional Director, mentioned that he was so impressed. I am so happy that I was in the opening, and I'm also impressed their discussions. Nothing about the youth without youth. Yes, youth are the future. I definitely wanted to continue to commit as a regional director to continue this dialogue. And at the very beginning of the opening, I mentioned WHO alone cannot work for the future of these regions. And I continue to feel that way, particularly after the 3 days. And I wanted to again thank all the partners engaged in the past 3 days. 950? Amazing. This is not the end. I wanted to make this as a start, and I really wanted to commit this kind of conversations, and the work relationship will continue from now on in the coming 5 years. So really thank you very much, and also congratulations to all of those who participated.
Great, thank you very much, Dr. Kasai. So that brings us to the end of this closing session and of course the end of our forum. So it really just falls to me to say again thank you to all of you for engaging, discussing, participating. It's just been wonderful to have you with us for the last 3 days. As the Regional Director said, this is not the end of the conversation, far from it. We look forward to continuing to work with all of you. As we mentioned earlier, we will be posting summaries of each of the discussion streams to Workplace, we hope later on today, and we'll put together a summary report of the entire forum, and we hope to have that with you by the end of this week. We've also just posted a link to a short evaluation. Please take the time to fill that in. It will only take you a few minutes. We really, really want to hear from you about your experiences of this forum. We've learnt a lot over the last few days, but we'd love to hear from you too. So thank you very much again for being here. Thanks to all of our panellists for joining me for this closing session. To the colleagues and partners who are here with us in the room, thank you very much, and bye for now.
Very good. Well done. Well done to all of you, and thank you very much for your hard work. Good.